Doctor, when we talk about folks that are on dialysis, what would you recommend?
Okay, well, Yolanda, when people have kidney failure and they're put on dialysis, in most cases, 99% of the time, there's nothing wrong with the kidney. And what's happening is the blood supply, the little microscopic arteries called afferent arteries that carry the dirty blood into the filtering units, which are called glomeruli, is blocked. And so there's nothing wrong with the kidney, but it's not working because it's not getting the dirty blood. So our goal here is to support healthy blood flow through those blocked afferent arteries and get the dirty blood into the filtering units, and then the kidney springs back to work. And so I've been doing this for like 30 years, so it works. It never fails. And the only problem you might have is absorption. So I always get people on a gluten-free diet, no wheat, barley, rye, and oats to maximize absorption, and then get them off of all the inflammatory things that actually were the cause of the blocked arteries. No fried foods. Got to stop the ongoing damage. No fried foods. No processed meats with nitrates and nitrites. That means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, all that kind of stuff. Absolutely no oils. That means no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarines, mayonnaise, hydrogens, and cooking oils, because they turn into trans fats, heterocyclamines, and acrylamides, which inflame the lining of the small arteries, which then cause the arteries to produce scar tissue, which plugs them. And then, of course, no gluten. You've got to maximize the absorption. No wheat, barley, rye, and oats. And then per 100 pounds of body weight, I like them to use the basic brain and heart pack, the healthy brain and heart pack, 1 per 100 pounds of body weight. And then also, I like to give the supplements that will support healthy blood flow through obstructed arteries and support healthy blood pressure. And so I'd have them take the Ultimate Daily Tablets, 1 bottle per 100 pounds of body weight. That's 3 tablets for breakfast and dinner per 100 pounds of body weight. And then I would also throw in the Ultimate Cardio Sticks. This also dilates arteries and supports healthy blood flow and healthy blood pressure. The Ultimate Cardio Sticks, one of those per 100 pounds of body weight, and they could take one at noontime or one at breakfast, one at dinner time. They come in boxes of 30 sticks, and so you have to figure out whether you need 1 box or 2 because of the body weight. And then lastly, I'll throw in our Ultimate Niacin Plus. Ultimate Niacin Plus is a time-release, non-flush, 500 milligram tablet of niacin, but it also has an enzyme called nattokinase, which actually is legendary for digesting and digesting blood clots. And then it has the English hawthornberry and a couple of other herbs that dilate arteries and help blood flow through blocked arteries. So it's just really a great combination between the dietary change, with the diet's inflammatory foods, what causes the problem. And we've taken people who haven't urinated, Yolanda, in 10 years, have not urinated in 10 years, are on dialysis 6 times a day, and in a couple of months' time, they're beginning to urinate. It starts out as a teaspoon, and then it goes to a tablespoon, and then it goes to a half a cup and a full cup, and then full volume of urine, maybe over a period of a month or so. And in another couple of months, we're able to usually wean off the dialysis as long as they stay on the diet. That's forever, and continue the supplement program according to their body weight. Just miraculous results.